So right now really is a critical time here in Colorado as we wait to see if the state's first case of measles in 2 years will remain isolated or spark a larger outbreak.
So here's what we know tonight. CDPHE says an unvaccinated adult from Pueblo contracted the disease after traveling to Mexico. They returned home and to work before experiencing symptoms, potentially exposing others at 2 separate locations in Pueblo. State health officials are now working on contact tracing. They say the best way to protect yourself is to make sure you're vaccinated.
Measles is also not just a rash illness. Measles is actually a severe infection. It is so infectious that if there are 10 non-immune people that are exposed to measles, 9 of them will go on to develop infection.
Denver has been preparing for this day for weeks as cases rise nationwide. They held a free vaccine clinic at the Joe Shoemaker School today. There's another clinic tomorrow at the same location.
So this makes Colorado now the 20th state in the U.S. with a recent measles case. Outbreaks have been popping up pretty much across the country. The CDC says as of March 27th, there are 483 confirmed cases in the country, and that is already higher than the total number we saw in all of last year. Last year we saw 285 cases nationwide. We know you have a lot of questions. We have a lot of questions. So when we have questions about these things, we call her in tonight to take this thing in depth.
We call the experts. So joining us now to discuss this further is UCHealth Senior Medical Director of Infection Prevention and Control, Dr. Michelle Barron. No stranger to the Denver 7 studios. Welcome back, Dr. Barron.
Thank you.
Well, we appreciate you helping us understand this very complicated issue.
So it was, I think, 2 weeks ago yesterday, you and I were talking, and you said flat out, it's not if, but when. Here we are. It's here. So why is it here, and why is this spreading right now?
It's spreading across the country because, like Colorado, there's lots of pockets of individuals that didn't get their measles, mumps, and rubella vaccine, or maybe only got 1 instead of 2. And measles is just so infectious. Like, one person can potentially infect up to 17 people. So all you need is a couple of people that aren't vaccinated, and you have a case.
A lot of us adults think, hey, we were vaccinated as kids, we're good, right? So is there a need for a booster, and who needs a booster more than others potentially?
So it's a good time to check to see if you've had vaccines, and if your parents are around or your providers, ask them. If you've had 2 MMRs or MMRV, which is varicella, because some kids came into the age where varicella was part of that vaccine, then you're good. No booster, no titers, nothing. If you only had 1 or you're not sure, you can either have your provider check an antibody titer, or you can just get an extra vaccine. And again, consult with your provider just to make sure that you're not on medications or there's something that potentially would interact with the vaccine that you maybe shouldn't get it, but most people will be eligible.
So any other considerations, something to be careful with for expecting moms?
Moms should not get live vaccines during their pregnancy, but certainly if you're considering getting pregnant, the MMR has rubella and measles, which are both things that you would want to protect your baby against. And so that's something you should try to get when you're in the early stages of planning, or if you have to get it, you'll end up getting it after you deliver.
Let's talk a little bit about the symptoms and who's most at risk.
So anybody unvaccinated is at high risk. Children in particular are more likely to develop complications. So you want to be really thoughtful in terms of vaccinating them. The symptoms are at the beginning very generic, cold-like symptoms, maybe a runny nose. It can progress to get pink eye, sore throat, maybe a cough, and then the lovely rash will usually starts on your face and then spreads to the rest of your body, as opposed to like chickenpox will start on your belly and then go outwards. So that's how you might be able to distinguish the two.
All right, we're so glad we have you as a resource. We all are, everybody out there. So thanks once again for your time, Dr. Michelle Barron tonight.
Well, Denver 7 is staying on top of measles in Colorado. You can find the latest data from the CDC, an interactive map of immunization data statewide, and information on vaccine clinics right now on our website. That's denver7.com.